Hi there. I'm so excited to welcome you to the Arthritis Life podcast, where we share arthritis life stories and tips for thriving with autoimmune arthritis. My name is Cheryl Crow, and I am passionate about helping people navigate real life with arthritis beyond joint pain. I've been living with rheumatoid arthritis for 20 years, and I'm also a mom, occupational therapist, video creator, support group leader, and I created the Room to Thrive self-management program. I am so excited to help you live a more empowered life with arthritis. We're going to cover everything from kitchen life hacks to navigating the healthcare system to coping with friends who just don't get it. Seriously, no topic is going to be off limits on this podcast. My interviewees and I share our honest stories of how chronic illness affects our lives. This includes discussions about mental health, sex, shame, pregnancy, body image, advocacy, self-acceptance, and so much more. You'll hear stories from all ends of the spectrum, from a person who's living in medicated remission from psoriatic arthritis to somebody living with severe mobility restrictions and severe pain from rheumatoid arthritis. You'll hear how people manage their conditions in different ways, like medications, mindfulness, movement, social support, work accommodations, and so much more. You'll also hear from rheumatology experts who just get it. We'll dive deep into the science behind chronic pain and what's the latest evidence for lifestyle changes that can help you thrive with arthritis, including exercise, sleep, nutrition, stress reduction, and more. This is your chance to sit down and chat with a friend who's been there. Ready to figure out how to manage your arthritis life? Let's get started.
Welcome to Rheumer Has It, the podcast that busts myths, highlights evidence, and inspires hope for living better with rheumatic disease.
Through plain language interviews with experts and reflections from our patient advocacy experiences, we offer actionable knowledge so that you can thrive today.
My name is Eileen, and I live with rheumatoid arthritis.
My name is Cheryl, and I also live with rheumatoid arthritis.
Join us as we bust myths
and spotlight evidence.
Now, in this episode, we are going to go over why myths, stigmas, misconceptions matter. But first, we're going to break down the differences to better understand them. Cheryl, take it away.
All right. We're going to define the three terms, myths, stigmas, and misconceptions. And these do overlap a bit, but myths are generally defined as false beliefs that are accepted as truth. For example, a common myth for arthritis is that arthritis only affects older people or elderly adults. But in reality, autoimmune forms of arthritis like rheumatoid arthritis, as we know, can also affect young adults and even children in the form of juvenile idiopathic arthritis.
Absolutely. I was diagnosed at 29, but my symptoms started around 23. I've also met many people diagnosed when they were just toddlers. Rheumatic diseases really do not care about age.
100%. And if you're wondering, what is the actual definition of stigmas? Stigmas are societal judgments that lead to discrimination. So a common stigma, unfortunately, for people with arthritis is that people with arthritis are just lazy. Now, this is a really harmful stereotype that ignores the real pain and fatigue caused by rheumatic disease.
Yeah, I used to have a lot of self-blame because I struggled to do daily tasks that healthy people can do easily. One of the biggest lessons I learned when diagnosed with RA was how debilitating the chronic fatigue is.
I totally agree with you. And the last term to define before we get into more examples is misconceptions. So these are simply misinformed ideas based on erroneous or wrong assumptions. So for example, a common misconception is that arthritis is always just mild joint pain. Now, of course, some people may have mild pain from arthritis, but in reality, conditions like rheumatoid arthritis and lupus and psoriatic arthritis can cause severe systemic pain and also issues with your tissues. I like to say you got issues with your tissues in other areas of the body, including the lungs and heart. In fact, that's why, if uncontrolled, rheumatoid arthritis is associated with a reduction in lifespan because of these systemic effects.
Autoimmune conditions cause inflammation, not just wear and tear. Joint pain is serious, even if it is just osteoarthritis, which isn't an autoimmune disease, but a rheumatic disease. Arthritis is often linked to increased risk of heart disease, diabetes, and even certain cancers, often appearing before these conditions due to the inflammation from the condition.
Yeah, that's such important information to remember.
We are going to share a little bit about our own personal experiences with myths, stigmas, and misconceptions, and why they have been harmful in our journey with rheumatic disease.
If you have ever felt completely lost or utterly alone while trying to navigate real life with rheumatic disease, listen up. I am here for you. I created an educational program to help you go from overwhelmed to confident, supported, and connected in a matter of weeks. And it's called Room to Thrive. After earning a master's in occupational therapy and completing hundreds of hours of additional training, I created a step-by-step guide to help you truly thrive with rheumatic disease. This is the only program I know of that's designed to improve quality of life for people living with inflammatory, autoimmune forms of arthritis, like rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, non-radiographic axial spondyloarthritis, Sjogren's disease, and more. During the self-paced lessons, you'll learn how to manage pain and fatigue, cope with stress, navigate relationships, and continue doing the things that matter to you and bring you joy. The goal is really to help you improve your quality of life and learn how to thrive with your rheumatic disease right now, rather than waiting for a distant day when it might be cured or healed. I really created the down-to-earth, practical, heartfelt resource I wish I had had when I was first diagnosed at age 20. If you want even more in-depth support, you can join the 12-week Room to Thrive virtual support group, where you'll be surrounded by people who actually get what you're going through, people who will provide the encouragement, validation, and support that you deserve. Each group is expertly moderated, so you don't have to worry about the kind of misinformation that spreads like wildfire in the free-for-all social media groups. If you're on the fence, don't just take my word for it. Here's what Katie had to say in March 2023. I was lost and overwhelmed with my RA diagnosis. It felt overwhelming to know what to read, what to do, how to spend my energy trying to research on the internet. Room to Thrive did that for me. It's been like getting a crash course in my diagnosis along with a community who gets it. To see all the details, including the dates for the next support groups, go to the link in the show notes or bit.ly/thriveroom with a capital T and capital R. You can also just email me anytime at info@myarthritislife.net. And don't delay if you're interested, because each group is capped at 16 people or less in order to make a small, intimate group atmosphere. Thanks so much for your time, and I can't wait to get started with the next groups. And I can't wait for those of you who are interested in the self-paced option to go ahead and join that at any time. Bye-bye for now.
First, we're going to go over misconceptions. Now, Cheryl, what is a misconception you believed before your diagnosis?
A misconception I believed, I have to say, even after my diagnosis, was I thought rheumatoid arthritis only affected my joints. I didn't know that my symptoms like dry eyes and fatigue were related to rheumatoid arthritis at all. In fact, until I was studying for my master's in occupational therapy 7 years after my original diagnosis. So I think it's really important that people who are newly diagnosed understand that rheumatoid arthritis is, like you mentioned earlier, a systemic whole body disease. What about you? What's a misconception that maybe you believed before your diagnosis of rheumatoid arthritis?
Very similar to you. And I just want to clarify, we're talking about rheumatoid arthritis, but rheumatoid arthritis is one of the most common forms of rheumatic disease. However, the symptoms like pain, fatigue, cognitive dysfunction, malaise, skin issues, all these sorts of symptoms that come with autoimmune forms of arthritis overlap with other conditions. So if you live with lupus, psoriatic arthritis, Sjogren's disease, we're talking for you too, because we are rheumatic. We're roommates, really.
Yes, we're roommates with RATUM. I love
Yeah. Yeah. The rheumatic disease mate, not just rheumatoid arthritis. But we're
Yep.
talking a little bit about our own personal experiences, having been diagnosed both with rheumatoid arthritis. But going back to the question of very much similar to you, I really honestly never imagined arthritis was an autoimmune disease and was something so serious and something that could affect someone my age. When I first received my diagnosis, I was actually in a lot of disbelief. I had my rheumatologist run test after test after test, bone scan, MRI, ultrasound, x-rays, all these things. Do a test for this disease, do a test for MS, because I was so confused that arthritis had symptoms beyond just joint pain. I didn't understand why I was feeling so tired, why I felt like I had the flu all the time, why I was catching colds and had a hard time brushing them off. Also, like, people around me really didn't understand that. They were like, it's just arthritis. And in reality, arthritis is a very serious condition. And I think there's a lot of stigma around arthritis. And I don't think rheumatoid arthritis the name needs to be changed. I think that people need to be educated on what arthritis really is.
Yeah, and I will put a link to the show notes because I think it is confusing for people to visualize the overlaps between the diseases of, lupus, which can involve joint pain, and, osteoarthritis, rheumatoid arthritis, axial spondyloarthritis. I've created a couple of charts that were informed by other charts out there. I think it can help to see all the conditions side by side and see, oh, yeah, these are the ones that are put together because they're autoimmune or autoinflammatory. Back to the misconceptions thing, I think there is a really healthy debate in the patient community of should we rename rheumatoid arthritis to rheumatoid disease? And that could be another episode.
Yeah, that's a good idea. And I want to just plug in another resource, my wonderful work, the International Foundation of Autoimmune and Autoinflammatory Arthritis, which we cover 22 different autoimmune and autoinflammatory forms of arthritis that have overlapping conditions, but different symptoms that kind of make them more unique. So another resource for kind of seeing the different symptoms and types of autoimmune of arthritis is AI arthritis.
Yeah, I love it. We'll definitely put the link to that in the show notes. The next thing we want to talk about was stigmas. So not just misconceptions and misunderstanding, but outright kind of prejudices people have based on inaccurate information. So I'm curious for you, Eileen, do you have any examples of stigmas you experienced after your diagnosis?
Oh, absolutely. And I think a lot of people are going to relate to but you don't look sick after we reveal our diagnosis to either people who are close to us or just random strangers. We always hear, oh, but you look so well. You don't look sick. Or if we're trying to get out of work because we're not feeling well, boss might say it, well, you look fine, or you did this yesterday. So things like that were quite irritating to hear at first because I certainly felt sick. And I personally felt I did look sick if you look close enough. Invisible illnesses are often debilitating. Even when somebody appears fine, if you take a closer look, you'll see how they're truly not invisible. And that's because my condition affects every aspect of my life. How about you, Cheryl? What common stigma have you experienced?
I think the biggest one for me, I will just to put this one in context, I'll first say that I was extremely athletic and very healthy when it comes to exercise and overall lifestyle. I was really health conscious. I didn't do any drugs. I saw my body as like a machine, and every single day I ran or lifted weights and or played soccer. And some days I did multiples of those things. So I think the stigma that really bothered me as somebody who was 21 years old and got hit with this diagnosis kind of out of nowhere is that the incorrect belief is that I must have done something wrong with my lifestyle to get this, that it must have been under my control, that if I had just exercised more, that I had just eaten better, then it wouldn't have happened. And I feel defensive about that because I feel like literally how much more healthy could I have been? I not only was healthy in my lifestyle, I had an extremely untraumatic childhood. My ACEs score is probably 0. ACEs, adverse childhood events. So what I think is interesting is that this reveals a deeper psychological phenomena, which is that when someone is sick or hurt, we want to believe there was a reason why that happened. Because if there's a reason, A, and then B, if that reason means that it was preventable, then me as the outsider looking in can just, if I did the right things, then I could avoid that. When in reality, babies get cancer, right? Babies get rheumatoid or juvenile idiopathic arthritis. Babies get lupus that when they've literally in their entire life only ever had breast milk. Like the stigma that people who have chronic health conditions did something wrong in their lifestyle to cause it is one that really to this day, you can kind of see me getting, it riles me up to this day. And I'm trying to turn my annoyance with the stigma into like a productive solution by just educating people. At the end of the day, just because maybe there are lifestyle variables that can help with your symptoms, like having, a healthy diet or eating a Mediterranean-based, whole foods-based, plant-based eating pattern and strength training like I do and exercising, those are all really helpful things. But just because those help you with symptoms doesn't mean that the lack of doing those costs you to get your condition. Do you feel also like defensive along with me with this?
Yeah, I've made a meme about that before actually. Just because I exercise doesn't mean I am not disabled. I actually exercise to function better with my disability. And what I would just want to note that a lot of women, because autoimmune diseases are affected 80% by women.
Mhm.
So they're finding like diseases like rheumatoid arthritis in particular triggers either the onset of a disease or progression of a disease after women have a baby. And that was the case with me.
No, forgot about
Am
that.
I going to blame myself because I had a child that my disease became more active? Like, no, we got to stop blaming ourselves and thinking, why did this happen to me? We have to move on, is what I like to think.
Yeah, it's not only a form of ableism to think that if you just did the right thing, you never get sick. It's also, there's actually another term I just learned about called healthism, which is like this idea that if people have a health condition, they must not have had healthy behaviors. I think that it's just really important to recognize, like so many of you. The thing is that the reason this is important, not only for the outside people that might judge us, but it's important for the people with the condition. Because if you believe that if you just did the right lifestyle factor, you would heal or cure your RA, you are going to be set up for failure. Yes, there are some people who are able to go into remission alongside doing some lifestyle factors, a drug-free remission. It's not common, but it does happen occasionally, but it's not the norm. The majority of people with rheumatoid arthritis require medication to sustain a remission. That's just literally scientific fact, and there's nothing wrong with that. And if people have that prejudice, and that stigma against themselves for taking medicine is going to cause them to delay treatment and have potentially serious consequences, like in terms of irreversible joint damage. So anyway, that's my spiel. That's my spiel on that.
That is an important skill for people to hear, regardless if they have a diagnosis or they are supporting someone or just interested in learning more about rheumatic diseases. Now, we touched a little bit on myths. We need to go over those. What's a myth others think about rheumatic diseases that you find you run into quite often?
Yeah. It still happens to me. I'm 43 now and I got diagnosed at 21, and that you're so young. How could you have arthritis? And I think this is really important because the myth that doesn't happen to younger people leads to diagnostic delays. People in the emergency rooms, urgent cares, primary care office also often believe that. They'll often say that joint pain in a growing person, a teen or a child, is just from growing pains. And so that's a huge problem. The second one is that if you just did some natural method, you'd be able to heal or cure your RA. And that's dangerous because it causes people to not take evidence-based medications that are actually much more likely statistically to put them into remission. What do you think? What's a myth that's important for you to correct?
I'm going to go back to when I was in elementary school and think about the myth that I learned about arthritis, the very first myth, and that is if you crack your knuckles, you're going to end up with arthritis, and how that shaped my perspective of arthritis at young age and for so long until I was diagnosed with it myself. And I remember every time like a joint would crack or something, I'd be like, oh, I'm going to get arthritis there. Well, yes, I am, but it wasn't because my joint was cracking. It was because I had an autoimmune disease.
Yeah, yeah, I know. And that's one of my favorite little jokes is when someone asks if I'm wearing the compression gloves and someone's or a splint and someone says, "Oh, what happened to your hand?" And I say, "My immune system." Or like, "What?" And I'm like, "It's my immune system. It's creating antibodies to the synovial lining of my joint." So, I think we've already talked a little bit about why it's so important for us to personally and professionally for me to correct these myths and misconceptions and stigmas, but I also think it's important to address how these might affect our mental health as patients on a deep level. So, what are some ways that these misconceptions and myths and stigmas affected your mental health?
Well, at first, all the misconceptions, all the stigmas, and all the myths I heard left me feeling confused, lost, and even questioning whether my symptoms were real. I found many people in my close-knit circle would question my illness because of the issues surrounding rheumatic diseases, awareness in general, and because my disease is invisible. I also firmly that as a woman, some people just didn't want to believe me. I was being dramatic and attention seeking. I didn't really know how to really voice what I was going through. This was really difficult when I was in the grief process of my initial diagnosis. But as I learned more about my condition, I gained confidence to advocate for myself and educate others who had like the wrong ideas around rheumatic diseases. So, what about you? How about you? Did this affect your mental health at all?
When I really reflect on this question on a deeper level, I think that I've had to establish a relationship to optimism in my life. And that might sound like, huh, what does optimism have to do with this? Well, I was a kid, according to my parents, that was kind of like a happy-go-lucky, optimistic child. And so there's even a book called The Optimistic Child. And I was like, yeah, that kind of sounds like me. But I think that there is a line between optimism and delusion that I had to confront. So if your optimism is in the form that if I just try hard enough, I'm going to be able to control my health. That's what worked for me in the past, right? Prior to 21. I ran every day. I tried my hardest. And if you keep training, you get a little bit faster. You get a little bit faster each time. Okay. So, you know, that that would work in the context of soccer or track and field, which I also ran, but it did not work for rheumatoid arthritis. It's fundamentally like I have these two different parts of my personality. There's the optimism and the realism. One of my friends once asked me this really interesting question, which is like, would you rather be right or would you rather be happy? And it's like, that's a really hard question for me to answer. But honestly, when it comes to being a patient educator and advocate, I'd rather be right. And being right, it means sometimes you're making people in your life less happy. I wish that I could tell everyone in my support groups or in my room with my program that you just follow my 3-step plan and you're never going to have pain or fatigue again. But that would make you happy, but that's not real. That's not true. Right? How do I individually, as Cheryl Crow, the patient and the person in my context of my life, but also as a patient educator and an advocate, how do I reconcile wanting to say to people, look, there is a zone of control that you are going to have. Look, I can control like the fact that I exercised today. I did my strength training. I can control the foods I put in my body. I can control the medicines I put in my body. There is a point where like I have to accept, which is the hardest word, accept that there are things out of my control. I can't control whether my body is going to have a flare sometimes, and I can't control the fundamental uncertainty about my future. And so I've kind of had to reconcile who like I am as a person. I used to want to be that patient that just see it every day. Oh, she has arthritis, but she doesn't let it hold her back. She conquered arthritis, right? And it's like the optimism in me wants to say that, but the realism is like it's not a conquering like full stop. It's an everyday effort to thrive with this condition. So sorry, I just went in like 900 different directions, but does that make sense?
Well, honestly, these diseases, like I said, impact every aspect of our life. So you can go 900 different.
Yeah,
Uh,
that's true.
yeah. But in the interest of time, and
Yes.
we are finished our 3 themes of the episode, we are going to now summarize in 15 words or less what is one thing you wish more people understood about rheumatic diseases. And for myself, it is how serious arthritis is and the prolonged impact it has on someone's life. How about you, Cheryl?
Yeah, similar to what you just said, but I would say that, it's not just joint pain, it affects all areas of your life. So very similar to what you said. Every episode, we want to try to leave you with some real specific resources for education and advocacy. So Eileen, I'll put it in your court. What are some resources you have for people who might want to become more empowered to understand these myths and stigmas and misconceptions and maybe correct them in their own worlds?
Well, I always believe that diving into research is going to give you a lot of answers and prove that the arthritis is serious. So, being that I have been on the Arthritis Research Canada Patient Advisory Board for the past 7 years, I can personally say that you will learn a ton from them. So, please put that in the link. And then also, if you want to learn from patients, there is the International Foundation of Autoimmune and Autoinflammatory Arthritis, as well as creaky joints.
Yeah. And similar, I was going to say creaky joints too. And also the Arthritis Foundation has a lot of really helpful fact sheets. I used those in the American College of Rheumatology fact sheets about different conditions to help.
Yeah. And you can educate yourself because when I was diagnosed 10 years ago, I knew nothing about rheumatoid arthritis. And now I'm considered a patient leader. So, really, if you just take the time, you can learn too.
Yeah, 100%. So we want to make sure you remember that you can listen to new episodes of this podcast on the Arthritis Life podcast. This is like a kind of it's a podcast within Arthritis Life Network, so to speak. And, you can follow Eileen and I both on social media with the links at the bottom of the show notes, which you can also find in each of our show notes on our websites. And if you have any topic suggestions, we encourage you to reach out through the DMs on social media or through the contact forms on our websites. Anything else you would want to add, Eileen?
I'm just saying thank you for joining us for episode number 2. We have so much planned for you. So tune in next time.
Yeah, thanks so much again for your time. Talk to you later.
Thank you so much for listening. This podcast is supported by Room to Thrive, an educational program I created to help empower you to live life to the fullest with rheumatic disease. In the program, you're going to learn evidence-based tools for managing all the ways rheumatic disease affects your life. And my goal is to help you go from overwhelmed to confident, supported, and connected in a matter of weeks. You can go through the pre-recorded modules on your own in the self-paced course, or you can take the course along with a robust support group of new arthritis friends to support you and cheerlead you along the way. Learn more in the link in my show notes, or you can always go to www.myarthritislife.net. And if you like this podcast, I'd be so honored if you took the time to rate and review it. I also encourage you to share it with anyone you know who might benefit from it. I also want to remind you that you can find full transcripts, videos, and detailed show notes with hyperlinks for each episode on the Arthritis Life website, plus full episode videos on the Arthritis Life YouTube channel. If you have any ideas for content for future episodes, or you want to share your story on the podcast, please send me, Cheryl, an email at info@myarthritislife.net. I can't wait to hear from you, and thanks so much again for your time.